projects an additional 14.5 million climate-related deaths by 2050. Indeed, this is a staggering number and highlights just how serious this crisis is. Beyond this, climate change significantly weakens our healthcare systems. It disrupts infrastructure and strains the healthcare workforce, making it harder to provide effective and consistent health services. Addressing this challenge isn't just about protecting the planet, it's about securing our health, our community, and our future. So this panel, which is building resilient health systems in the wake of climate crisis in South Asia, is organized in collaboration with Alliance for Health Policy and Systems Research. The purpose of this discussion is to bring forward regional perspectives from India, Pakistan, Nepal, and Bangladesh, sharing lessons we have learned on climate change and health systems nexus, and to know some unique climate change challenges and how they impact countries' health systems, and some other common regional climate challenges and how countries are responding to them. Now I would request Dr. Robert Morton, who's from AHPSR. He's a public health policy specialist and leads the Alliance work on non-communicable diseases, climate change, and the social determinants of health. He has more than 15 years of experience working on health systems at global and country levels. Previously, he has also worked with WHO India country office to help rule out national primary healthcare reforms. He is online. May I request Dr. Robert Morton for his opening remarks?
Okay, good morning, good afternoon, colleagues. Thank you for the warm introductions. As you heard, I'm Robert Martin, and I'm based at the Alliance for Health Policy and Systems Research. We're a hosted partnership based at WHO in Geneva, Switzerland. I wish I could be there with you today in person. I'm sorry I'm not, but it's very nice to see all of you, very nice to connect with you online. As we know, climate change is probably the defining challenge of our time. WHO has called it the greatest threat to global health, to human health in the 21st century. Accordingly, at the Alliance, we began some initial work on climate in 2020. It's now part of our new strategy, Aiming for Impact. Our strategy is focused on how health systems can mitigate, adapt, and build resilience for climate change, how health systems can decarbonize and become resilient health systems. We all probably know, or maybe many of you know, that now more than 80 countries around the world have committed to developing climate resilient, low carbon health systems. I think Japan and Senegal are the most recent countries that have committed. But we don't yet have a shared understanding of what this actually means. How do we do it? What is a climate resilient health system? I think at the global level, we need to do more to support countries to understand how to do this, where to start, what to prioritize, how to advance. And so at the Alliance, starting in 2022, since 2022, I should say, we've supported work in 12 countries, and I'm proud to say that we've supported work in South Asia, but not only there, also in countries from Argentina, Mozambique, Tanzania, Uganda, countries around the world. And what we're trying to do is build a network, some shared understanding of how health systems and health policymakers can respond to climate change and share lessons on how to overcome barriers. We're hoping to synthesize evidence to respond to the crisis and move towards climate resilient, low carbon, sustainable health systems using mixed methods approaches and working closely with health policymakers. We really believe that health policy and systems research is crucial to understanding the impact and implications of climate change. HPSR, Health Policy and Systems Research, draws on a blend of public health, economics, sociology, anthropology, political science, and epidemiology. It analyzes how health systems respond, adapt, how health policies can shape and be shaped by health systems and broader determinants of health. We believe and strongly believe that the interdisciplinary nature of health policy and systems research is well suited to help us understand and tackle, address, overcome the barriers and the complexity of climate change. We believe it also can help us understand the linkages between climate and health. We believe that the health policy and systems research has a lot of value to add here and can accelerate evidence sharing and implementation to mitigate, adapt, and respond to the health and climate crisis. This work is progressing, but I have to say it's very uneven. It's lumpy, it's mixed. Research teams have supported and responded to national policy processes. They've contributed to health national adaptation plans. They've published papers, syntheses. But I think it's fair to say that a lot of challenges remain. There still are a lot of challenges about an insufficient national or local understanding of climate change. We have good sense at the global, right? I think, was it last week or the week before, there was a new Lancet climate countdown. We have the kind of global data of what's happening. We have the IPCC reports in a couple weeks. We're going to have the COP in Baku. But I think we don't yet have a deep local understanding of what this means. What are the implications for Pakistanis? What are the implications for Argentinians? We have some of the global models and estimates, but we don't have a deeper sense at the national level of what all of these changes mean and what they will do to humans. There's also just limited knowledge of how to respond, how to shift resources in response to these threats. There are difficulties prioritizing and sequencing interventions in response, right? What do we do when and how do we do it? So all of that said, I'm really happy. I'm delighted that this meeting is happening. I'm inspired. I'm looking forward to listening to the presentations, learning, and I hope that this dialogue, begins to create a small network, a small community of shared understanding that can help inform, inspire action, not only in Pakistan, but in the neighboring countries and beyond. So thank you again to SDPI for the invitation to be here and organizing this. I'm very much looking forward to our discussions today.
Thank you so much, Martin. Indeed, you are right that health policy system research is crucial to understand impact and implications of climate change. And I do agree that we have global data. We have IPCC report with us. We have COPs, but we don't have deep local understanding, and we are lacking in local level models. Thank you so much. And with this, now we would move towards our presenters. But due to time constraint, I kindly request our presenters to keep their presentation brief within 10 minutes. So our first presenter is Dr. Meghnad Dhimal. He is an environmental health scientist with over 20 years of research, teaching, and policy formulation experience working in Nepal, Maldives, Sri Lanka, and Germany. His primary role of expertise is on environmental health with more focus on climate change and health. Currently, he works as a senior research officer at Nepal Health Research Council. He is also an associate academician at Nepal's Academy of Science and Technology and visiting faculty of Environmental Health and Yale School of Public Health, USA. Dr. Meghnad, would you please share your slides?
Thank you so much for nice. Shall I share my slide or it's already shared?
Yeah, these are visible.
Okay, thank you so much. First of all, thank you so much to SDPI team for this invitation. And of course, I also wish to be there, but unfortunately, I could not be there because of other commitment. And many thanks to Alliance for Health Policy and System Research, especially Dr. Martin, for the support for this work in Nepal. So with the support of Alliance, we did a health policy and system research responding to climate crisis, lessons from Nepal. So I just want to share here the key finding of the study in a provided format. Thank you. Next slide, please. So in today's presentation, I tried to summarize the key findings or lessons in a three broader categories. First is what are the barriers for building a climate resilient and low carbon health system in a low and middle income country like Nepal. And second, I'll just talk about what are the current policy response to climate vulnerabilities in Nepal and what are been effective and what is not effective. And finally, I'll just talk the way forward. Next slide, please. Next slide, please. Yes. So we all know that climate change is a public health crisis, right? And there is a increasing, or growing ethical crisis. That means there are the certain countries, or let's say developed countries, who emit these greenhouse gases, but the victim are the global south, And in terms of evidence, if you see again, most of the publication come from the global north and very negligible from the global south. That means we don't know the magnitude of the problem. How much burden of the disease is attributed by the climate change in the absence of evidences. But the people in the South Asia have already witnessed several impacts of the climate change. And there is not only impact on the vulnerable population, but also to the health systems and health infrastructures. So health systems bear the major brunt of the climate change with the overcrowded health facilities, delayed emergency service delivery, and continued care. Hence, developing a climate resilient and low carbon health system is a goal of every country. And like Robert mentioned earlier, means more than 80 countries have already agreed to develop a climate resilient and low carbon health systems. However, there are the very few evidences, especially from the global south. So one of the aim of our study was to document the initiative and good practice is a key for climate resilient system development. And we conducted this study in Nepal. Next slide, please. So for this, we also use the mixed method design. We're starting from the desk review and collecting the qualitative data through the key informant interview, especially with the policymaker and program managers. And we utilize the, as a conceptual framework, these 10 components of the climate resilient and low carbon health system, which is based on the 6 building blocks of health systems. And we also took the ethical approval from the Nepal Health Research Council. Next slide, please. So then what are the key challenges and barriers for developing a climate resilient and low carbon health system in case of Nepal? First, there are the very limited human resources in the health professional trained on the climate and health in particular. Even in general, the number of doctor-patient ratio is very low compared to the WHO guidelines. Similarly for the other health professional. So because of that, the existing health worker cannot work further to tackle the additional burden of climate change. So limited human resources are a major challenge, not only in Nepal, in other South Asian countries. Second one, the curriculum of the university has not inclusion of the climate and health in detail. So we provide the refresher training in service, but there is a frequent transfer system in the government job. As a result, experience in the trained people, allocate in the new places so that continuously you have to train. Otherwise, there is no institutional memory. That is another challenge. Third challenge is, very limited funding in climate and health. It is true in globally also because less than 0.5% adaptation fund goes to the health, climate and health. So in case of Nepal also very limited funding in climate health, and still we rely on the external funding. Next challenge is the lack of institutionalization of climate health in the federal countries. Now we are practicing the federal systems, and there are many policy documents like National Adaptation Plan, National Adaptation Program of Climate Change, National Health Policies, several documents, right? The key challenge is the translation into the practice, one. And second challenge is that we need to make such policy plan also in the province level, at the local government level, because they are the one who are in the forefront to respond to climate change. So that is another challenge, means how to mainstreaming the climate and health in the provincial and the local government plan and policies. Next, another major challenge is in, can you go back? challenge in implementing the policy into practice that I just discussed. And next is the very limited awareness on the health impact of the climate change. That means even in the grassroots level, the general public, as well as to the policymaker, there is very limited, understanding how the climate change affect the human health. So, and this is the, slow impact, the slow poison means people give the priority to the, acute problem, right? So they get overshadowed. That is another challenge. Next challenge is we have many old health infrastructures which are very vulnerable to the climate-induced disaster like the flood, landslides. So the vulnerability of the health facility itself is a challenge. And next challenge is for the climate and health, especially for the evidence generation in their long-term time series data. But still, we are based on the paper-based reporting systems. As a result, it's very difficult to get timely data and long-term time series data to generate the evidences. So that is also another challenge, especially to develop the early warning systems for the several climate-sensitive disease and risks. So these are the major key challenges and barriers. Next, please. However, if you see the policy response on climate change and health in Nepal, Nepal has started this work to respond to climate threat since 2007, organizing the first national workshop on climate change and health.
Not
And
sorry to intervene. Please keep it brief. You are running out of time. You have
okay,
just
next 2 minutes only.
Sure.
And then Nepal is also one of the first countries in South Asia to develop health national adaptation plan and also update it. And with the support of this alliance, we did several policy dialogue, and based on that, our latest SNAP 2020 to 2030 is prepared. Next, please. Next slide. So as a way forward to tackle all these issues, the important points that I want to recommend is developing a climate transformative leadership and governance at the federal, provincial, and local governance is very important. Similarly, we have to ensure the sustainable domestic and international financing on climate and health. Similarly, we have to invest on climate smart health workforce. For that, we can include we can update the curriculum of the university, as well as we can provide the refresher training, and promoting the digital health for establishing long-term data repository is also very important. And finally, promoting the health in our policy for both climate change mitigation and adaptation is very important. Thank you so much.
Thank you so much, Meghnad, for wonderful presentation and some of your key way forwards, including climate transformative leadership and governance at federal level, and sustainable domestic international climate and health financing, climate smart health workforce, and inclusion of climate change threats in health sector infrastructures. I guess these are really important recommendations. With this, now we move toward our next speaker, Dr. Apsona Ghosh. She's from India, and she's associate professor at Public Health Foundation of India. She is public health anthropologist working in the intersection between climate change, public health, and health systems. Her work focuses on building climate resilient and low carbon health systems in Indian context and climate adaptation mitigation co-benefits. Over to you, Dr. Ghosh.
Thank you, everyone. Thanks for inviting me in this interesting meeting. So today also, my sincere apologies. I cannot turn on my video because we are facing incessant rain in the area I'm staying. So it is the eastern part of India, and due to the very bad weather, my bandwidth is very low. So you see, this type of rain is not very common in November, and this is all due to the climate change impacts that we are getting the delayed monsoon in the coastal regions. So can I share my presentation?
Yeah. Please share your presentation.
It's said
Hassan, may I request you to provide her rights? Yeah. Dr. Ghosh, is there any issue?
Yeah, it's fine now.
Okay, perfect.
Can you see my screen?
No, it's not visible. Yeah, it's visible now.
Okay. As Dr. Dhimal has already mentioned, we are grateful to Alliance that we also have received similar grants to check the status of resilient health system in Indian context. And the study, it's a group of experts and organizations who did this study, and I'm part of that. Along with me, there are other 6 PI and co-PIs along with the research team distributed across various institutions in India working on climate change and health. We follow the climate resilient and low carbon framework given by WHO in 2023, which focusing mostly on building on the previous resilient health system framework, and definitely looking into the few key elements like the leadership and governance, health information system, service delivery, and climate and health financing. So our focus was not to look into all the sectors of the WHO framework, but we focused in these 4 aspects, which are the very, which can bring the foundation of the resilient health system in the countries. So we have the Ministry of Health, we had the civil society agencies, we have the communities, and who all are basically responsible for the health system delivery and health information system, including the health and climate and health research in terms of building resilient health system. So the study applies, as I mentioned earlier, the study applies the WHO framework to assess the current resilience of India's health system, but focusing on the ability to manage the climate-related impacts, including heat, floods, drought, cyclones, in 3 states. We select 3 states. One is the dry desert area of Rajasthan. One is the cyclone-prone and coastal area of Odisha, and the landslide and rain flooded area of Uttarakhand. So we selected this study based on a hazard mapping done by IIT Delhi, and based on that, that hazard mapping depended on the 2 most important data set. One is the IMD data, in Indian Meteorological Department data of rainfall and heat and cyclones, and definitely the concentrations of health facilities across the India. So with these 2 parameters, we selected these 3 states, and we also selected 3 districts, that is Chamoli in Uttarakhand, Jaipur in Rajasthan, and Puri in India, based on their vulnerability towards the climatic impact. So as similar to Nepal, we also did a detailed literature review. It is also, our study is also a mixed method study. We did a detailed literature review. We try to understand the cross-sectoral collaborations in terms of policy coherence, to come up with a climate and health policy. We looked into the comprehensive coverage of climate-sensitive health risk. We looked into the coverage of adaptation options and actions in terms of health, national health adaptation plans of the health sectors and the allied sectors. We looked into the resourcing, the budget. We have covered all the budgetary allocations done by the Indian government as well as by the foreign funders, how much the fundings are going towards the health and climate and health issues. And we also try to come up with the monitoring, evaluation, and reporting pattern of the health adaptation, national health adaptation plans. And in that sense, we did a detailed analysis of the national the NAPCCHH, that is the National Action Plan for Climate Change and Human Health, which Government of India launched in 2018, and it's continued to be implemented in various states and the district level. So state level plan has already been implemented in various states, across all the states, whereas the district level plans are yet to be implemented, and the training of the district level nodal officers are going on. So we did a combinations of all the stakeholders possibles. We did the landside plan area of Uttarakhand. We did the community visit. Then we did we visited the few health facilities of Rajasthan and Puri district in Odisha. We saw that major focus is on building the solar panels. That is one of the major initiatives, low carbon initiatives or the resilient initiatives have taken by the health facilities across India. Sorry. So in terms of the stakeholders, we did a detailed consultations of the stakeholders starting from the national level. We have the nodal agency, which is National Center for Disease Control, who is holding this National Adaptation Plan for Climate Change and Human Health and responsible for its implementation. We have the Project Advisory Committee. We have the NCDC people in the Project Advisory Committee, and we have other non-governmental sources, other stakeholders, mainly the big donor agencies who are financing the various adaptation and mitigations projects, interventions in India. So we then come to the government level player. We did interview the state level policymakers. We did interview the academia, the philanthropists, developmental organizations. Then at district level, we have the district nodal officers, healthcare facility of medical officers, the community health workers, the community members, and all the community-based centers. But at the same time, to cover the social determinants of climate and health, we interviewed the non-medical health departments, which is the allied departments, that is the disaster department, our Department of Art Science, Renewable Energy, Water, and Environment. So we tried to gather as much as stakeholder possibles across the sectors.
Dr. Ghosh, sorry to intervene. May I request you to wind up your presentation within 5 minutes?
Yes, sure, definitely. So I'm not going to go to detail of the findings, but definitely like to highlight some of the major issues which the study has found. Found out. So first component is definitely the climate transformative leadership and governance, which is WHO's one of the stress point. The component is addressed. Definitely, we have come up with a plan. And if we see the indicators given by the WHO, if we can see except one or 2 points, most of the indicators are green. That means the national government, at least, and along with the state governments, they are try to implement all these indicators in their planning. If we take the component 10, that is sustainable climate and health financing, the results are not very bright. We have many red corners, for example, the result of vulnerability and assessment and HNAP used to access health funding and financing mechanism has not been done yet by any of the states. Key learnings from these two components is definitely we need more interdepartmental collaborations between the health department, the women and child development department, and disaster management department. We need a stronger financing mechanism for climate sensitive illness. Again, a collaboration with the disaster management authorities. If we see another major component of the WHO framework, that the health workforce, the training, specifically the basic training of the district and sub-national level, sub-district level healthcare providers is yet to be achieved. It's a kind of a mix of red and green indicators. The training specifically, I want to focus that the training for the low carbon and sustainable health system is very much lacking, because there is a lack of incentive or kind of understanding that why we need a low carbon health system. So that is a big challenge, because people are not the implementers at the district and sub-district level. They're not in very much understanding that why we need this solarizations or any other thing. If we take the component of health and climate research, there is also a mix of green and red. we have the agenda is there, the interest is there, people are getting into this climate and health research, but a long way to go in this sector also. In terms of climate informed health programs, we mostly come across the red boxes because the integration of climate informations, the early warning system, or the other components of monitoring and evaluation is yet to come. And there is a very much lack in the implementing the GHG emissions and reduction reduction interventions. So that area is totally red for our study. So to conclude the study, what the study learnings are that health system of India needs both the adaptation and mitigation components, though we are trying in both the sectors, but a long way to go. Skilled health workforce we can understand who can understand the climate and health linkage and maintain the surveillance, preparedness, and sustainable healthcare practices. There are few things are already happening, but it need to be continued for longer term. Especially, it need to be incorporated into the medical curriculum for the final year of the medical students. So developing the mental health support and counseling skills to address the post extreme weather events trauma, that sector is yet to be developed. Effective communication strategies to translate the scientific evidence into, especially the vulnerability analysis of every district and health facility plan, yet to be transferred into the actions. Successful integration of climate components in the training programs are definitely there. And we hope in recent years, India will cover the training till the frontline health workers level. Lesson learned and best practices for scalability and adaptation for mitigation in different contexts definitely is very important. And I think in this context, this particular meeting where India, Pakistan, Nepal, and Bangladesh are collaborating and sharing our own learnings, it's very crucial, and we need to see future events like this. Thank you so much.
Thank you so much, Dr. Ghosh, for such a wonderful study on Orissa and Rajasthan and the key takeaways. Like you have given the recommendation of skilled health workforce, effective communication strategies, integration of climate component in training program, and lesson learned and best practices for scalability and adaptation. Thank you so much. With this, now we move toward our next presenter. She is Rabia Tabassum. She's from STPI Pakistan. And I would just... Okay, Ms. Rabia has work experience of over 6 years with Ministry of Finance and STPI. Her research expertise include education, gender budget analysis, digital trade, e-commerce, public financial management, and data for SDGs. She also worked with USAID, DFID, IDRC, GIZ, ODI, and many other relevant government departments at federal, provincial, and local levels. May I request our IT team to present our slides.
Thank you so much, Khansa. And along with me, another team member, Mr. Qasim Shah, is also here. He is Deputy Executive Director and also part of the study. Khansa and some other colleagues, Syed Mustafa and one engineer, Nuran Shah, was also part of this study. So we're just recently concluding our study that is basically building climate resilient health infrastructure. That is a case study of Punjab and Sindh. So for this case study, we used flood as a reference point because that is one of the major climate hazard in Pakistan. So, as you know, floods in 2010 damaged 5.3% healthcare facilities, which is now 13% of total healthcare facilities in 2022. The number of high-risk facilities in Pakistan is expected to increase by 33% by 2050, and the 22 floods, which caused $109 million damages to the health sector. Also, the stagnant water after floods provides breeding grounds for mosquitoes, increasing the transmission of diseases like malaria and dengue. And again, 46 million people in Pakistan will be at risk of contracting the malaria by 2070. So we used to explore the structural damages, infrastructural damages to the healthcare facilities. We focused on the component 6 of the WHO framework, and particularly we used WHO checklist of assessing the vulnerabilities in healthcare facilities, which is basically, as you can see, covers 4 components of healthcare facilities, which are health workforce, energy, infrastructure, and WASH.
Where you may change the slides on the main screen, please.
Next, please. Okay. So for this study, we selected 4 districts: Shahid, Benazirabad, and Ashura Feroz in Sindh, Dera Ghazi Khan and Rajanpur in Punjab. And we covered 41 healthcare facilities, including both primary and secondary healthcare facilities in these districts. And we conducted 30 key informant interviews with health department, climate change, disaster management, planning and development, communication and works department, also med department, district administration with from the health side, or the local representatives of the disaster management committees and engineers as well. So moving on to the finding slide, we found out that major climate risk reported by the healthcare facilities was flood, followed by the heat wave and air pollution. Next, please. Yeah. So moving on to the structural damages to the healthcare facilities, we observed that 70% of the surveyed healthcare facilities were partially damaged. And the type of, sorry, we can't see the slides over there. Yeah, please. Thank you. So the type of damages we observed were mostly related to the settlements in floors, cracks, roof leakages, damaged furniture, equipment that is making unsafe for the occupancy. And also the stagnant water and inaccessibility, which made it impossible for nearly 50% of the healthcare facilities to function during the floods. And another major major damage that we observed was the damaged staff quarters and boundary walls, which was reported by nearly 40% of the healthcare facilities. That is contributing to the staff absenteeism and raising the safety concerns as well. And another finding, according to the survey, is we don't have 80% of the healthcare facilities don't have leak-proof roofs, that making them vulnerable to heavy monsoon rains every year. And we observed that buildings with elevation performed relatively better during the floods. And related to the energy services in healthcare facilities, mostly healthcare facilities are shifted to the solar backups, and because of and the reason was because the power outages, long power outages during and even normal days. But this is again a good indication of low carbon emission from the healthcare facilities, right? But the existing solar backups are not enough to meet the energy demands for the healthcare facilities, and at least they managed to provide backups to the vaccinations at the healthcare facilities. Next is about the water and sewerage system. Most of the primary healthcare facilities don't have proper drainage. And you can see it was open septic tanks situated in low-lying areas, that making them prone to the sewage overflows and flood water contamination during these kind of events. And lack of potable water is a major issue in healthcare facilities of particularly Sindh, that requires functional water filtration. And another observation related to the waste was hospital waste was going to the open burning pits. So another environmental concern. Only a few are using the incinerator. So, related to the planning and construction issues, we observed that through the interviews with the stakeholders at the district and provincial level, the compromise site selection that was inconsistent to improve for the new healthcare facilities. Luckily, and there's a good example that Sindh has initiated discussions around revising the flood levels from 2 feet to the 4 feet to set the criteria for the elevation. That's how I can, every province can learn from the Sindh how they are integrating this climate resilience facilities aspect within their planning and implementation. Regular inspection of building in terms of damages and the potential risk for the next season was missing. And inability of the planning and development processes that we have right now at place to incorporate the unfavorable natural conditions and while building construction, like provision of the water supply and sufficient backups. I think this is what we need to make sure that these are the stuff, these are the material, these are the power backup to ensure for climate resilience of the healthcare facilities in future. And we also observed that healthcare facilities under public-private partnership reported in a better position to incorporate climate risk for renovation and reconstruction of the damaged healthcare facilities. We also observed that MHRVAs is mostly not available in the districts where we surveyed, and where it is available, utilization is a concern. And limited health financing, as we all know, in public sector is one of the major challenge. And there is need to use climate disaster lens in the resource allocation as well. Next, please. Related to the health workforce, district health departments are well managing the existing staff through pre-planning. That is very good example that other countries also follow. However, staff shortage reported by the 40% healthcare facilities in our study. And obviously that leads to the overburdened staff during these kind of climate crisis events, and damaged roads and damaged residential buildings is limiting the staff capabilities to perform during these events. So we observed that doctors have developed their capacities because they are receiving to some extent these the trainings, but the technical staff and they need such opportunities. They need particularly targeted focusing trainings to better prepare themselves and respond to the climate crisis. Next, please, last one. And to conclude, if I request Mr. Qasim to just, yeah.
Thank you so much, Rabia, for setting the tone of this whole presentation. And some of the findings might be resonating with the earlier presentations, which are coming from Nepal, India, and later we are going to listen from Bangladesh as well. But the couple of things which Rabia has already described here were explored at a different level. When we went to the different facilities, it was not just the BHUs. We also tried to look into the primary healthcare facilities available at the Tahsil level. And we tried to look into the overall development processes happening within the district and within the provincial domain. By the time we started the study, there was a national adaptation plan was already released. So we actually used that national adaptation plan to identify the gaps where we should actually do this study. And while we started looking into the literature around Pakistan, we found out that the health facilities is one, health infrastructure is the one area, perhaps where there is a need to come up with some study, some research, because this was kind of a virgin area. We could not find much of the research available. Even in the National Adaptation Plan, if we look into the health infrastructure, the relatively it's less covered compared to the other sectors of the health sector, which are pretty much very detailed. So this is something where we actually started looking at, and thanks to the World Bank studies, they provided some background information as well, that the damages to the health infrastructure are basically making Pakistan more prone to the disasters, especially when it comes to the floods. So looking into the policies, we found out that MHVRAs perhaps was the one tool which has recently been introduced and used by the provincial governments, both in Punjab, both in and Sindh. But the findings of these studies have never been utilized. Their utilization was minimal, actually, when it comes to improving the health infrastructure at the district level, or at the BHU level, or RHC level. Similarly, when we look into the public-private partnerships, and when we talk to the private sector, which was basically engaged during the different eras over the last 10 to 15 years, we found out that the contracting system, they were not quite happy. And they found out that the enabling environment was perhaps missing. And that needs to be improved if the government really wants an investment from the private sector into the health infrastructure. And so, this is something which should be part of the, and we also felt when looking into this contracts, that perhaps this was not precondition for most of the private sector players who are engaged in the health service delivery, that they are requested to invest into improving the health infrastructure as well. So the drainage system, I believe people have talked about it, and we have seen that most of the Sindh was submerged after the 2022 floods. And when we went to Nowshera Feroz, and we found out that a couple of facilities which were like fully damaged, even after like a year time, the people were not satisfied. And even if the dispensaries were built, and wherever the dispensaries were built, the people were complaining that accessing those dispensaries was again a problem, because those are far from the villages and might not be accessible most of the time. One example I have, a particular one example, is that the government is actually raising the new construction where the health facility was fully damaged in the same area where the flood is like a recurrent phenomena. It was 2010, it was damaged. In 2022, it was again damaged. And the third time we are building in the same place. And God forbid that if tomorrow there is another flood, perhaps there will be another loss to the. So building the health capacities, I would not like actually to go into details, but we found out that perhaps this is one area perhaps where the government needs to focus, and not just the government, perhaps it's the academic institutions. And since Dr. Marine is with us here and she is an academic, perhaps the people like her can actually brought this discussion more, not just with the doctors, as Rabia said, but also for the paramedics and the technical staff who are involved in this process. And the final thing from our side was basically to use the climate change disaster lens into the planning processes as well. And that's not happening if we go into detail and start looking into the budget documents. Perhaps this is one of the considerations which should be there. And this lens was not properly seen either when we started looking into the budgets from the Punjab or for the Sindh. Similarly, the last thing was the local governments. Local governments have a lot to play, a lot more role here. But they are completely missing, except in KP Local Governments Act 2013. If we look into the other two provinces, local government acts, say it's Punjab 2011 or the recent amendment in 2022, or in the Sindh Local Government Act, perhaps that was not there. And one of the things which is coming from the National Adaptation Plan very clearly is that perhaps it's the time that the local government should be at the forefront while it comes to managing the disasters. And I stop here. Thank you.
Thank you so much, Rabia. Your presentation took me back to the field where we extensively visited some areas of southern Punjab and interior Sindh, and did survey of primary and secondary healthcare facilities. And thank you so much, Qasim Saab, for future considerations. Though I won't add any comment on technical side, because I believe Marine is the right person to do this. But I would reiterate some future considerations. I completely agree, as you said, that incorporating climate climate resilience of structural element is quite important. And along with it, integrated planning and close flood revamping, enabling environment for private partnerships and capacity building of health workforce are quite important. And I also believe that strengthening local government is the main thing in which we're lacking. So with this, now we move toward our last presenter, Dr. Syed Manzoor Ahmed. He is associated with International Center for Diarrheal Diseases, Disease Research, Bangladesh. He is esteemed demographer, statistician with over 29 years of experience specializing in climate change and health. He currently leads the Climate Change, Health and Population Science Unit. His research focuses on developing interventions that build resilience among vulnerable communities facing climate risks, particularly in Bangladesh coastal areas. With this, over to you, Dr. Syed Manzoor Ahmed. We are unable to hear you. May I request you to unmute yourself, please?
Can you hear me?
Yes, sir.
Okay, okay. Good afternoon to everyone. I will be discussing the problem of resilience loss of health system in Bangladesh due to climate change, some research findings, and the initiative we are taking to strengthen the resilience of health systems. Bangladesh uniquely geography intensifies climate-related health risks, straining already burdening health system and endangering millions to coastal and rural area, especially with rising temperature, sea level, and disease-spread outbreak. Tailored studies are crucial to building health system strengthening and community level. Now I want to share a few climatic variable. That is, if you see, that is over the year in Bangladesh, the number of hot days increasing. Also, we have conducted study in the indoor temperature and outdoor temperature. We have found that in the household temperature varies according to the household construction material. We have seen here the river water salinity and groundwater salinity. If you see here, the coastal area are more exposed to salinity. Now, this is the graph that is we conducted a study in the coastal area. We have found that temperature associated with the miscarriage. We also conducted a study about the child nutrition. We found that near to the coast, if you see the distance from the coast, the near to the coast, malnourished children are more. And we also conducted another study that the temperature during the birth is related to the child nutrition status. In Bangladesh, there are two things is important currently. There's, if you see the dengue over the year in 2019 is peak up. We also problem with the cholera. If you see the graph, over the year number of hospital admission is increasing for cholera. This is the outbreak of cholera in Bangladesh. You know, the Dhaka hospital. If you see this 2022, the admission of hospital is very high. Here in the coastal area, we have measured the sodium in drinking water, especially for table. If you see here, the near to the distance, the sodium in drinking water is high. Also, the consumption of salt consumption is very according to the hilly plain in coastal area. Also, salt consumption higher in the female. We have conducted this study. We have a health and demographic surveillance system in Chakkuria coastal area. We have found that miscarriage are near to the Mata Mohori river. Also, miscarriage are more near to the sea, close to the sea. In ICRB, there are two health and demographic surveillance system. One is the Matlab and another is the Chakkuria coastal area, what I mentioned here. We have compared the mortality due to kidney disease. We have found that in the coastal area, the mortality is 2 times higher compared to the Matlab non-coastal area. We have found the mortality under 5 mortality concentration to the that is close to the sea, low-lying area. So we have compared the mortality under 5 mortality with the national level. We have found the 33% excess mortality in the coastal area. during the cyclone or something like that, we have found that the moving on the post-disaster healthcare provision, 64% reported of unable to access to healthcare because the roads were submerged. More than half of the respondents informed that there were no doctor in facility during the disaster, and half of the respondents sought health support from the local paramedics and village doctor after natural disaster. For the scope of this presentation, we are going to focus on the 4 strategic pillars for health system resilience. That is, one is the disease surveillance, early warning system, policy support, and infrastructure adaptation. Now I want to share a case study in Chokra coastal area. If you see, there is a heat wave in Bangladesh in 2023. If you see, then during the heat wave, the children keep outside the house because during that time there is no electricity. Also, the tin house is very high, temperature is very high. So we need the community health infrastructure, that is training and health worker, capacity building, community engagement, education. Also, we need the policy support for resilience, that is the integrated climate health policies, robust regulatory framework, global collaboration networks, and support funding. We anticipate positive outcome for adopting the proposed strategic pillar, improve health outcome during climate crisis, overall betterment of the public health system through early warning system, climate vulnerability reduce, and susceptibility to health risks of vulnerable community reduce, enhance adaptive capacity of health system through community-based resilience, health infrastructure creation. For the future direction, we should be investing on expanding resilience health initiative, scaling successful intervention, allocate resource for innovative research and solution, strengthen cross-section collaboration, enhance capacity building effort for health professional. This is my last slide. I want to say that in Bangladesh there is a national adaptation plan, but in national adaptation there is a very few things about the health. So in Bangladesh, I think in the coastal area, especially the health system is very weak. So we need to think about this. Also in the Southeast Asia, we can collaboratively work for further. Thank you very much.
Thank you so much. Thank you so much, Dr. Saab. I believe your some recommendations like expanding resilience initiative and scaling successful interventions, investment in outgoing research, strengthening cross-sector collaboration, and increasing capacity builds are really important. With this, we will open the platform for question answer sessions. Please raise your hand, introduce yourself, and ask your question. I would request to keep your question brief. Thank you so much. Yeah, please, sir. Someone, Hassan, please give him mic.
Thank you very much, and congratulations to all the presenters. Excellent, insightful presentation. I would like to add one element which somehow didn't come across. I'm conducting a research for 6 countries in Africa and trying to understand the impact of austerity measures, climate change on health and education sector. One of the findings which is coming very clearly, and it is evident in Pakistan case and others as well, that the climate change is impacting heavily the education sector infrastructure. But those countries who are under the agreements of IMF and following austerity measures, they are having hand tied because they have to reduce their spendings. That is impacting the reconstruction of health facilities. People claim that if there is reconstruction, it's only in certain parts and not the complete building. So in that way, it's having another kind of impact. So I would like to suggest that in your further researches, particularly those countries who are following any austerity related measures, if they could also consider adding this element. Thank you.
Thank you so much.
My name is Aftab Alam Khan from Resilient Future International.
Thank you so much, Aftab Alam Saab. Qasim Saab, would you like to add something? Okay, that's fine. And do we have any question? Yeah, from Gain.
Thank you so much. So, thank you for these wonderful presentations indeed. So, I'm taking a leverage having Dr. Ghosh's presentation from India before you, Rabia, and she mentioned about SOPs on healthcare facilities and the infrastructure. Maybe this would not be in the kind of scope of your study, but I just wanted to know, Qasim Saab is with us. So what is the situation in Punjab and Sindh in that context? So do we have SOPs available? If yes, how much these climate change implications have been incorporated? If not, is there a clear-cut gap available? And where we have Dr. Sabha with us to comment on that. So over to you before Dr. Sabha.
Before actually commenting on what Faisal said, yes, there are SOPs available, and these are pretty much, if you go into a primary health unit, basic health unit, or you will find out there that these are available on the walls. It's pretty well explained, and every employee within the health facility, actually, who ever can read, are aware of those SOPs. How much it's being implemented, or how conducive is the environment actually to implement those, that remains a big question. Because sometimes there are some, like Rabia mentioned, that power outages are like for 12 hours in certain parts of Sindh. We observed it similar was the case in Rajanpur, and the backup which was available for 8 hours. So the health workers themselves were not able actually to do anything in that case. So, and the most of the backup which was provided either through the solar or some other systems was basically to protect the vaccines. Otherwise, we saw doctors and the paramedics sitting in like a scorching heat there within their rooms even, and some of the health facilities, they don't have the windows available. And so those sort of issues were there. And when we asked the engineer who was accompanying us for this field work, he said that if we standards for these buildings, several are the cases where the government standards for these buildings haven't been, the code haven't been used properly for even at the time of the construction. So those sort of issues were there. But before giving the floor to the chair, for all of you, and also Robert, if you are still around, yesterday we had this session in which we talked about the climatic issues at the regional level. One of the issue which was like common for all the 5 countries, India, Pakistan, Bangladesh, Nepal, and Sri Lanka, everybody talked about it, was the smoke. That this has become a recent phenomenon. This is the 5th now, the season which we are observing in this part of the world, and perhaps that is creating lot. And the air pollution is one thing which was coming number 3rd on in our study. Reason being that we visited the areas which are pretty much interior, where there is no industry, where the traffic flows are much more minimal compared to the urban areas. And these are far from the border areas as well. So perhaps this is one of the area we need to put some effort actually to do some work at the regional level, not perhaps at within our national boundaries, because this is more of a regional issue now. So with these, I stop here, and thank you so much, Aftab sir, for pointing out this issue of looking into the IMF conditionalities. We pretty much know that, yes, hands are tied. We don't have the financial resources available. So most of the work which is happening within Pakistan, and perhaps you might be aware that, yes, we are trying to explore all kind of funding windows actually to fund the work or to come up with some plans to cope with the challenges of the climatic changes. And the best example is that after 2022 floods, the government of Pakistan launched an emergency funding appeal together with the United Nations. And some of the, like if we look into the pledges, it was 35% which actually materialized. The remaining 65% and the 35% which materialized were basically some of the funds which have already been committed, which were diverted from one reason. Either it was for education or health system. Those were diverted to actually to deal with the climatic challenges in Pakistan. So with this, I believe, yes, the government is doing a lot. Mostly in terms of research and studies at the federal level, but at the provincial level, when we go and see, perhaps the situation is like the provinces need a kind of hand holding from the federal ministries, because here the capacity is much more concentrated and much more refined human resource available compared to when we visit the provinces. And if we could do that, perhaps, and with a better coordination within whatever the resources available, perhaps we can think of a change which we are dreaming today in coming days. And I stop here. Thank you.
Thank you so much. We have 2 more questions. Yeah, please. Yeah, please.
I'll just make a few comments, which is going to answer your question as well as yours. So Pakistan is a signatory to Health Declaration during COP28. And as a result of that, we confirmed that we'll submit our Health National Adaptation Plan this year. So with regards to that, climate risk and vulnerability assessments were carried out in Balochistan, Punjab, as well as in KP, and with the help from FCDO as well as WHO, we have completed those vulnerability assessments. And since there was a paucity of time, we could not submit our HNAP this year, but hopefully next year it's going to be done. And so once we have the document, the Health National Adaptation Plan, that is going to kind of have an evidence-based document to tap funds from GCF, from Adaptation Fund. In addition to that, from the Adaptation Fund, with WHO being the IE, the implementing entity, Ministry of Health has already applied for a grant of 13 million to train the workforce across the country in terms of building climate resilience. So I think that kind of covers both the areas.
Thank you so much, Dr. Marine. We have 2 more questions. Please, Dr. Aisha. But please keep your question brief.
Okay, thank you very much. Good afternoon and congratulations to STPI. I'm a public health person, and it's a comment and a question as well. And Dr. Mehreen has already answered partially to my question as well. The Dr. Saab from Nepal discussed about the transformative leadership, resilient leadership. Now, Pakistan, we are a unique blend of people, and I believe that we are a resilient nation and we come up with out-of-box solutions. So this leadership and all of the presentations were talking about system strengthening. So all these things can be strengthened under a strong leadership and including private sector as well into their partners. So I was just, I needed to listen to what you said, that if you are leading this and in cooperating all this, so I'm sure the system will be strengthened here.
Thank you so much. I would request Dr. Marine to answer it in the end.
So Ministry of Health, we are working at developing, building the resilience of the healthcare system. So in that regard, we are looking at all the different building blocks of the healthcare system. So even our CRVAs, which we've conducted, we still have to do it in SIM, GB, ICT, and AGK. All these 3 areas are really important. All the 4 areas remaining are very important. But once we have the CRVAs, which are focusing on all the building blocks, then whatever the final document that comes out of it, and this document kind of has the roadmap, for future roadmap for the adaptation and mitigation built into the the assessments. So that's going to be a comprehensive document, which is kind of going to look into the leadership aspect as well as the governance, as well as the infrastructure and all these things. So hopefully in the next 1 year, we are going to be in a better place to like kind of present our case internationally.
Thank you so much. Please, just last 2 questions. Yeah, please, ma'am, you.
Hello, my question is to Dr. Syed Manzoor Ahmed, if he's here. So I want to ask about, you mentioned that there are lots of miscarriages near the sea level. There was a report in The Guardian as well that due to climate change, there's a lot of incidents of miscarriages. But it's interesting to see that it's near the sea level. I just want to understand, have you been able to figure out what's the causation of these miscarriages? So this is a technical question. And also I want to have a comment on, I'm from Climate Action Center from Karachi. So we monitor the air quality with our instruments on our building. So the government is not doing a lot because, you know, Karachi is a big city and the air quality is not being measured. And the instruments that we have with the SEPA, they are not functional. So, you know, that responsibility lies with the government to monitor it with what we have. So that's just a comment, and I would like to
First, we will take your question. So please introduce yourself and ask your question.
Okay. Actually, as with reference to your remarks, introductory remarks, I could not find the covering of all the things in the presentations. Of course, it may be short, but I would like to mention that, of course, threats are coming. So is it possible if you people, as a public health people, can make some research trends to meet the coming threats? Of course, you can ring the bell. You are the people who can ring the bell for the public. Of course, threats are coming because environmental issues, everything. So if we can make some package of research trends, and that trends may be shared with the public universities, especially biosciences. I'm also Dr. Ehsan from the Applied Biosciences. So I think we can meet issues to some extent, at least.
Sir, thank you so much. It's a really wonderful suggestion, and we will surely discuss it after a panel. Now, may I request Dr. Marine Mushtaba. She is Director, Climate Change, Nutrition and Health from Ministry of National Health Services Regulation and Coordination, Islamabad. She's an expert in environmental health and impacts of climate change on health, with extensive experience spanning over a decade in providing advisory services to UN agencies, intergovernmental organizations, semi-government organizations, international and national NGOs, multilateral development banks, and academia. Dr. Marine, I would request you, as you are a government representative, so what's your take, and give us a few 2 to 3 recommendations along with the concluding remarks.
Okay, so the recommendations are embedded in the concluding remarks. I'm not going to hold everyone for a long time. So ladies and gentlemen, distinguished guests, esteemed colleagues, a very good afternoon to all of you. This discourse today around building a resilient health system in the wake of climate crisis is extremely pertinent, as we've all discussed. And this is our effort to lay the foundation. Today is an effort to lay the foundation for building the resilience of our health system. And it is heartening for me to see representatives from government agencies, from NGOs, think tanks, academia, which was supposed to be here, but I am from academia as well, international organizations, since effective climate resilience requires the involvement of multiple stakeholders. Climate change poses a significant threat to health systems, particularly in low and middle income countries, which often face resource constraints and heightened vulnerabilities. As Sir mentioned, the constraints in our resources. Climate resilient health systems are essential to ensure that health services can anticipate, they can respond to, they can cope with, and they can recover from and adapt to climate-related shocks and stresses. Hence, there's an urgent need for resilient health systems that can sustain improvements in population health despite the instability in the climate. In order to achieve climate resilient health system at Ministry of Health, we have developed strategies that address the WHO health system pillars. These key strategies will have to take into account service delivery by enhancing infrastructure resilience, comprehensive training programs for health workforce on climate-related health issues, In addition, there's a need to develop robust health information systems that integrate climate, health, environmental data to support decision-making. Another very important aspect for building the resilience of health system, especially in the current scenario, is establishing sustainable financing mechanisms that integrate climate resilience into national health budgets. Finally, and most importantly, strengthening leadership and governance structures to incorporate climate adaptation into health policy and practice. So in a way, I've addressed all the 6 building blocks of health. I would like to conclude here by adding that building climate resilient health systems in South Asia requires a comprehensive approach. And this inter-regional dialogue has kind of paved the way for that. And this is going to allow us to address the vulnerabilities and the capacities of the health system. In this regard, addressing health disparities and promoting equity are also crucial. Vulnerable populations require targeted interventions to ensure their health and safety in the face of climate change. And I would like to congratulate SDPI and Mr. Abid Soleri for arranging the 27th Sustainable Development Conference and our guests for their insightful presentations. Thank you.
Thank you so much, Dr. Marine, and Dr. Syed Ahmed Manzoor want to add to address your questions. May I request you, sir?
Yeah, thank you very much. So I want to respond that the question is the miscarriage is higher close to the sea. So we have a surveillance system in Chakuria. I want to say that we have a 20 years data of pregnancy outcome, and also we have test the salinity water level. That is the table water. We have found that salinity is higher close to the sea. Also, salt consumption is higher to the sea. So gestational hypertension and miscarriage, that is the adverse pregnancy outcome, is a established thing. So we are thinking that there is a relation between the gestational hypertension and miscarriage. Now we have a funded Wellcome Trust done a big fund. We are integrating all of this data. We are measuring the salinity as well as the gestational hypertension, and we want to link and examine this thing. Thank you very much.
So much. May I request photographer for group photo and for audience, thank you so much for your patience and for your questions. My colleague Hassan has food vouchers. He has rancher food voucher. He would give to you.
Thank you, Khansa. We have food vouchers for Ranchers Restaurant. It's available downstairs in food court. You can enjoy your food there. Thank you very much for joining us.
Who's photographer? Please, group photo ke liye aa jaye. They are not here. I guess we have some people from academia and development partners. Okay.